Hi, my name is Dr. Al-Ghazawi. I'm an orthopedic sports medicine surgeon, and I have more than 10 years of dealing with ACL injuries. We see a lot of ACL injuries this time of year, fall sports, winter sports, people just being generally more active and participating in what they love to do. You see a lot of coverage on the news with the NFL and collegiate sports and these high-profile athletes getting similar injuries to you, the ACL injury. But there's also a lot of misinformation out there on the internet about best treatment options, outcomes, and what to expect with the ACL and recovery. In this video, I'll cover the general way that people tear their ACL and the most common ways that they do that, as well as the most common treatment options for you. It's important really for cutting, pivoting activities. You don't really need an ACL to walk in a straight line or even run in a straight line. But anytime you turn and pivot or load and shift your knee, that's when the ACL really plays its role. The most common way to injure your ACL is what's called a non-contact pivoting injury. So you'll see players kind of plant their foot, their momentum continues forward as they're trying to turn, and that load becomes too much for the ACL, and that's when it tears. We know that ACLs are, again, important, and we know that people that don't have ACLs develop arthritis earlier in life, and they also start to injure their other secondary stabilizers, like their meniscus, and their cartilage wears out. The reason why the ACL doesn't heal on its own is really based on its blood supply and its location in the knee, and that's why it's such a common surgery for athletes. When they tear their ACL, really the best option to get them back out and playing and doing, again, the things they love is an ACL reconstruction. Some of the common symptoms of an ACL tear, if you think that you've experienced that, first off, patients tend to describe what's called feeling a pop in their knee when that moment happened playing their sport. Their knee will swell up, it'll become painful. A lot of times that swelling and pain will decrease over the period of days, and then you'll experience an unstable feeling in the knee, a bit of shifting or, again, instability. What we do is we get x-rays, make sure that you don't have fracture or broken bone that's causing these symptoms. The MRI is going to be really helpful in understanding, is the ACL torn or sprained? Did we injure anything else in the knee that can cause that pain and swelling, including the meniscus or the cartilage or maybe one of the other ligaments in the knee? Just like most things in orthopedics, there are multiple ways to address injuries. The unique part about the ACL is, again, it doesn't have the best blood supply, so it doesn't tend to heal. There are situations where you might just have a sprain, which is rare. Sometimes we treat that with conservative treatment like anti-inflammatories, rest, physical therapy. Ultimately, if there is a tear of the ACL and you have these subjective feelings of instability, the best course of action is an ACL reconstruction. There's a lot of different ways that people have reconstructed the ACL. If you're young and healthy, we tend to want to use your own tissue. This is called an autograft. We can take tissue from your hamstring, your patellar tendon, your quad tendon, and reconstruct the ACL. The difference between the graft option is somewhat dependent on surgeon preference, your age, whether you're male, female, and your activity level. There is another option if you're slightly older where we can take donor tissue, or what's called an allograft, and reconstruct the ACL that way. Ultimately, no matter what graft option you and your surgeon decide, there is a pretty intense recovery. To get back to cutting, pivoting sports, it's somewhere between 10 and 12 months. Some of that is based on just the biology of the ACL healing, but also the fact that your quad gets weak and we really need to work on getting your strength back to get you safe and ready to play the sport that you love. So physical therapy, and you're going to be responsible for how well you recover. We can do a perfect surgery, but you're going to need to take responsibility and really focus on your physical therapy and putting in the work to get your knee ready to get back to sports. If you have questions about ACL surgery, please feel free to reach out, whether via email or you can call my office and make an appointment at 212-737-3301.